All right, Nikki, thanks so much for being here. My first question that I have for you is tell the audience a little bit about Family Voices and how it all got started.
Great, thank you. Family Voices is a national organization that really started with a lot of families of children with disabilities and medical complexities working together to get policies changed around home care waivers and different barriers they were experiencing in the healthcare system. That was 30 years ago. And so, if you've heard of a Katie Beckett waiver, the founders of Family Voices were the ones who brought that to life. Since then, Family Voices has continued to advocate for youth and family engagement in healthcare transformation by making sure that people have lived experience have a seat at the table in making decisions about how these systems change and work for them.
Because that's what I was gonna ask. Like, how does Family Voices work? What's sort of the nitty-gritty?
Oh, the nitty gritty is that first we help organizations get ready to engage families. So lots of organizations say, I want to get families involved in our work, but they don't quite know where to begin. So we actually have a lot of assessments and tools to help them get started in ways that are meaningful and that honor families' lived experience and expertise. And then on the other hand, we support families who are involved in this kind of systems change work because if you've ever done it, you get thrown into a room with a bunch of professionals and you're not always sure what to do and how to speak up and use your voice. So we support and mentor families doing that work, and we make sure that the organizations are providing the right environment for them to actually use their voice in those spaces.
Mm-hmm. And what's sort of the process involved to get that underway?
Well, a lot of times we're working directly with an organization that's seeking help. And so we'll have a contract or an agreement with that organization, and we come in and figure out where do you need to begin? What's the level you've been operating at so far? How have you engaged families, and what is their level of satisfaction with that? And then we come in and say, okay, here's what we can do to make this better. Do you have youth at the table? Do you have more than one family? Is there diversity among the people you have involved? Are you paying them for their time and expertise? So we give them a lot of advice on how to improve the way they're engaging families, and we support them through that process.
Mm-hmm. So how do you guys as an organization, how are you guys different from other organizations? Like how are you guys unique, basically?
I think one of the things that makes us unique is that most of our staff and all of our board are people with lived experience, whether they themselves have a disability, whether they are raising a child with a disability. We all have been in these systems. I am neurodivergent. I have a child who is autistic and who has a rare genetic condition. And so we bring that into our work of having navigated these complex systems, which really helps us know on the provider side what they need to do differently, on the system side what they need to do differently, and it helps us know how to support families as well. So it's the lived experience that we bring to it.
Mm-hmm. What do you think's been the ongoing issue in terms of like, helping these families? And how do you guys as Family Voices help those families, navigate through the complexities of, have navigating, with their child, who has a disability or whatever?
I think some of the ongoing things are just how complicated it is. One of the cool things that I think about Family Voices is we have a network of organizations across the country. So we have a network of family-led organizations in every state that can actually help people have that one-to-one support and guide them through the system that exists in their state. As you know, Medicaid is different in every single state, and different processes change based on where you are. So our network of organizations are the ones that will hold a family's hand and walk them through how to get the best supports, where to go for the care. And that's one piece that we do. But the other piece is we really do look at these systems and work with a lot of the major players in these systems to make sure that they are making changes that are meaningful from the top down. And that can affect people all over the country.
Mm-hmm. What about in terms of advocacy work? Do you guys do any sort of advocacy work on your end?
We certainly do. We are advocating for Medicaid because we believe it's a very important support for people with disabilities and special health care needs. We advocate for peer-to-peer support programs, for accessibility of language in all places, and we also advocate for making sure that the transition from childhood to adulthood is done in the way that supports the best care over the course of a lifetime.
Mm-hmm. And what if people told you, what if people told you from like when they go through Family Voices, what have they told you about their experience?
Well, they've told us that this is where they learn and grow. They get to see things from a national lens, and often we start with families who are really participating at their local level or at their state level, and we get to bring them into a national organization and show them what it looks like across the country. So I think one of the things we're great at doing is taking people from that personal experience to a broader advocacy experience that looks at that we, like let's collectively look at the systems that serve us.
Hmm. And finally, how can Family Voices, be that sort of guidance or sort of that help for those who are, in the same situation, like that other families may encounter?
I think you can reach out to Family Voices or your local affiliate. You can go to our website, familyvoices.org, to find out what your state affiliate is. And we create a lot of tools to help families navigate these specific processes. One of the things we do is we work on specific issues in healthcare. So whether that's language access or transition to adulthood, or just making sure that families are engaged at the bedside, we create tools and processes that are easy for families to follow and understand. And we make sure that across these states that we have in our network, we provide those tools to them so they can walk families through that hand in hand.
Mm-hmm. All